Hello, my colleague. So, digital transformation. Do we really need a digital transition on our daily practice? Is it the right time to implement digital technology in our clinics? So, let me just think. If we are the patients, what exactly, and we are willing to do a treatment for our teeth, what exactly we are looking for any patient who lives in this online generation. They will come with their expectation. Always they have a high expectation from aesthetic wise, and they need from that treatment to be functional, so it will not harm their muscles and temporary mandibular joint as well, and it will survive for a long time. So to be able to compensate, we need a new era where it can give us or enhance our treatment quality, and as well reduce the cost and the time. So because our time it's really costly, we need a solution to reduce our time, to reduce the appointments and the patient visits, and as well to reduce our cost without affecting the quality of our treatment. So, as we know, for any treatment, you should plan it in advance. So, all our treatments, it's 80% plan and 20% treatment. You should keep in your mind any case, even for simple cases, you should plan your cases in advance to be able to give your patient the treatment which they are looking for, from aesthetic wise, from functional wise, and as well to survive for a long time. So let me see some simple cases, and then we can think and take a decision if really it's mandatory to implement digital technology in our daily practice. Most of us face such cases. The patient will come with broken or fallen single restoration, and in normal cases or a normal scenario, or let me say the traditional scenario, especially it's an anterior case, this patient may takes at least 3 visits or more, depend in your lab technician. You need to get first, this is the first visit, so impression. Second visit will be the try-in, and most probably, since it's an anterior teeth, it might be need a correction for the shape or the shade. So again, you have to send it back to your lab technician, and at least need again 2 to 3 days. First visit to second visit to 3 days, second visit to the third visit 2 to 3 days. So we are talking about a week in some cases. So do you think that your patient will be able to survive and socialize normally without his anterior tooth? I don't think so. So, if you are able to save your patient time, to save your costs, and give the patient the treatment which he's looking for, by digital technology and in a simple way, what we are able to do, just we can scan the case with your intraoral scanner, and you can ask your scan or your software to copy and mirror the left side to the right. So here it's exactly the same shape, the same size, the same length of the left side, and then send that one to your milling machine. Once it's done, it's here. This video will show you the steps. So this is the patient, come in, you just scan, start the designing, and then send it to your milling machine right away. At the same time, do the try and get the approval from the patient, glaze it, stain it, and it's done. All of that can be done on only one single visit. Within 30 to 40 minutes, you are done. So, comparing to the traditional way, you saved a lot, you saved your time, you saved your cost, and also you have a highly satisfied patient. So, one more case. This patient, she came to our office complaining from this aesthetic. So, and the nice thing, this patient, she already had a previous consultation with two dentists. The first dentist gave her an option to do an extraction for this one. It's a gemination tooth, so that's mean the lateral and the canine join together. So do extraction and then make a bridge between the premolar, the central. The second consultation, which is more conservative. The second consultation was to again extraction and place two implant two implants to save the central and the premolar from aggressive preparation. But do you think it's a right solution? You might have a different option, but this is the patient. When she came, she told us her dental consultation. So what we did for this case, since we have the technology, we just scan and send our scan to our designing software. And a designing software, it gives us an idea that we can do two veneers over that big tooth. So, but it needs some more correction for the gum. We need to do gingivectomy. We need to do some kind of preparation. And here we go. And from the digital technology, you can also get some kind of information or a helpful tool to give you exactly how much you need to prep, from where you need to prep, and as well the gingivectomy. So at the same time we get all in this information, we started with the preparation and gingivectomy. We use here the BioLase laser and then send it to our milling machine, and at the same time we got her two separate veneers. So again, this case we able to help our patient in a really short time and less cost, and as well enhance their experience and improve their satisfaction. Again, one more case. Again, aesthetic. So if you notice that most of the cases, it's an aesthetic cases. So the patient, they need a solution right away. They cannot wait. They don't want to wait, and also you cannot compromise the quality of your treatment if you will just rush in your treatment. Still, you need to use the slow dentistry concept. But the digital will help you to reduce and minimize your unfavorable time or with your technician, whether with your planning or implementing the treatment. So in this case, the patient came and she's complaining from her old restoration As you notice here, we have a composite restoration in both centrals. The rest are really fine, and she like the natural looking of her smile. So we just digitally uh, plan and start our treatment by removing her all composites, and then we did minimal preparation with finish line, and then we scan the case, we send it to designing, and here we are doing the designing, and the patient is still in our office, so we can talk to our patient, show her how her teeth will look like, get her input if she needs the teeth to look longer, shorter, wider, whatever the design of the teeth overall. So, and at the same time, you can show your patient the shade of her original teeth, and you might ask her to do kind of bleaching to whiten her teeth while your milling machine grind her new veneers. So send it to your milling machine right away. At the same time, do the try-in, get the approval from your patient, and then it's done. All of that, all this transformation done within a couple of minutes, let me say hour or 2 hours. So we are able to give the patient the treatment which she's looking for, and at the same time without wasting our time or without multi unneeded visits. So more complicated case, again the patient, she came uh, to our office complaining from her old bridge and the defective fillings. So again, scan, design, cement, all at the same time. Get the approval from your patient, show her what you are willing to do, and then implement your treatment. So plan first, then implement the treatment. Here we remove the old bridges, the old bridge. We remove also as well the defective filling. Minimal preparation done. Scan, utilizing the intraoral scan. Make sure from your finish line that you have clear finish lines, clear preparation. Then send it to your lab. The lab will design for you. You can show this one to your patient, get the approval from your patient, and then let you see again the designing. In few hours, you are able to design, virtually articulate that, get the shade. All this information can be you can have all this information by digital way, then send it to your milling. And in this case, we used zirconia restoration. So zirconia restoration, we have a multi-layer, multi-translucence. We just add some staining and glazing, and it's done. So this is the before, this is the after. Huge transformation with minimal preparation, less dental visits. And at the end, you have a high satisfied patient. So, veneer case. I believe in some countries, veneer treatment, it's really a highly demand, but at the same time, on such cases, the patient has a really nice teeth, except the two central. Maybe with some ortho treatment, we can enhance her overall aesthetic. But the patient, she refused ortho and she wants something uh, more aesthetic. And it's our rule actually to show our patient how her teeth will look like, and it's her right to know if we are willing to prep from her teeth or not, and if so, how much exactly we need to prep and from where and why we have to prep from her teeth. So, and to be able to do that, if you will do this case in traditional way, you have to get an impression, send it to your lab. Your lab technician will do for you the wax up. He will send it back after a couple of days. You need to call a patient for a second appointment and try to show her the models. For sure, she will not get an idea. And if you will do something more advanced and beneficial, you will do for her a direct or indirect mock-up, which will looks really bulky, especially in her case, and it will not work, and then you will compromise the decision of your patient, and you might lose your patient. So what we did here, digitally, we just scan, design, and here I'm using the 2D PowerPoint smile design, but now I'm using the more advanced digital smile design from 3Shape. But still, it's a way, it's a tool to show your patient what you're willing to do exactly, and then send it to your lab. Your lab will duplicate that one and make for you the conversion between the 2D to 3D, and he will send you back some couple of photos for how the smile will look like, and if you need to do a preparation, how much exactly you need to prep, and from where you need to prep. So now it's a time to call your patient for the second visit. To call your patient to second visit, show her all these photo, get the approval from your patient, and then you can test your design or show her how the design will look like by print a direct mock-up according to the design that comes from the software, get the approval from your patient, and then you can start the treatment and the preparation, all of that, and that's at the second visit. So once it's done, send it to your milling machine, mill, glaze, and at the third visit, you are done. So here again, we use the zirconia multi-layer multi-shape with some staining and glazing, and the case it's done. So again, how digital technology helped me and helped this patient reduce the time, reduce the cost, and enhance the aesthetic which is looking for. And since we are using the digital technology, so all the parameters it's already available, and we are able to guarantee the treatment longevity. So having a Ferrari car doesn't mean you are the best driver in the world. Digital technology, it's a learning curve. Still, you need to enhance your background, enhance your experience, uh, get a lot of information, attend courses. So this is really will be helpful if you are planning to get in digital technology, and to make sure that you will not be left behind. Within a couple of years, I believe digital technology will be as essential part of our offices. So enhance your experience and your knowledge, attend some courses, do trials, try. Even if you fail, you should learn from your failure till you get the till you are able to get the maximum benefit from implementing digital technology in your daily practice. Thank you, and I'm planning my second video, which will be about some more advanced cases, so stay tuned.